I'm going to get started just by letting you all know who I am. I'm Fiona LaRosa Waters. I have the pleasure of introducing Dr. Mensah today. I was able to see her speak earlier this year at a conference in Evansville, Indiana, and it was just wonderful. So I'm really excited to be here again today. I work for Galen Hope. We're one of the educational sponsors for Weight Stigma Awareness Week. Galen Hope, we're a treatment program in Florida, South Florida. We have a location in Coral Gables as well as a second one in Delray Beach. We treat primary mental health and we treat eating disorders. And our co-founder, Dr. Wendy Oliver-Pyatt, is one of the co-founders of Weight Stigma Awareness Week Reborn, along with Shavis Turner, and hosted by Within Health and the Body Equity Alliance. Quick housekeeping. All of you should have your attendee dashboard in CE Go. Hopefully you're really familiar with how to use that. You'll get prompts to complete evaluations for any session you attend, and then you should have easy access to your continuing education certificates if you need them. I will put my email in the chat. If you have any trouble with this, you can reach out to me and I will put you in touch with someone either at Within Health or at CE Go to help fix that. Again, I'll put my email in the chat, fiona@galenhope.com. And then with Dr. Mensah's presentation, we're going to ask people to hold questions and answers to the end. You can certainly put a question in the Q&A chat box if it occurs to you so that you don't forget, but we'll be saving about 10 minutes at the end for those. And I think that's about it. So I am going to introduce our speaker. Let me just pull up. Dr. Angela Mensah is a communication professor, a published author, and has spoken at national and international conferences. She's currently a teaching assistant professor at the University of Arkansas as a joint faculty member of communication and African American studies. She's developing a service learning project where the University of Arkansas students work with a community partner to teach body liberation to youth participants. This program has been recognized by the National Communication Association with a Social Justice and Pedagogy Award. The title of today's session is Weighing In on Why They Don't Really Care About Us. Join me, thank you very much, in welcoming Dr. Angela Mensah.
Hello, and thank you for having me. I really am excited to talk to you all today. I'm very happy to be a part of the community and being invited by Shavis Turner, so I really do appreciate her support. And what I want to do is talk about this film, They Don't Really Care About Us. It's not a film, it's a music video by the late Michael Jackson. And instead of saving it for the end, I'm going to play it in the beginning. So kind of beginning with the end in mind. And so pay attention to the lyrics. And we are going to talk about this in the context of weight stigma and diet culture. What we have here is artifact, a rhetorical artifact that we are going to use and kind of deconstruct a little bit as it relates to weight stigma and therapeutic approaches. Certainly there was a lot of powerful speech there, a lot of powerful rhetoric there. And one thing that I want to warn you of is that this presentation does have some, kind of powerful speech in it. And so it's just a trigger alert and a trigger warning, but I hope to put it in a context in which you feel that you are respected. And if at any time you feel threatened or uncomfortable, please feel free to leave the webinar. Actually, there are several learning outcomes for this. And full disclosure, I'm playing around with some teaching AI tools that are really fun, that where I put in some really interesting prompts that I've been taught to do. And so some of the content has been derived with AI, some of the actual definitions. So the first learning outcome kind of talks about how the lyrics of Michael Jackson's songs and its relevance to what its relevance is to societal neglect and marginalization. And so what I'll do, instead of reading each of these learning outcomes, is when I get to the slide, I'll let you know what outcome relates to what slide. because I'm not a linear thinker. I never have been. This slide was an entirely different order when I first assembled it, and it's just the way I process information. So I certainly hope it makes sense to you. So W.E.B. Du Bois, Souls of Black Folks was written in 1903, and he posed this interesting question that we still deal with today, is how does it feel to be a problem? And when he says, how does he feel to be a problem? He's talking about, for example, I went to primarily white universities, white schools and universities since grade schools. So when things happen in society, oftentimes my white friends will talk to me about certain issues. And there's this kind of underlying sentiment that, you know, Angela, what does it feel like being the problem, being the Black person? Like those are your people kind of thing. And it's interesting in this context today because this community of fat activists, they already understand what it feels like to be a problem. They've dealt with weight stigma their entire lives. They've had friends and families and a lot of struggles. So when we work together, we're really coming from a deep understanding that a lot of other communities don't have when they're dealing with people that are not like them. So our experiences are very much intertwined. And it makes me happy that unlike, you know, the original feminist movement and the Black feminist movement being very separate movements, our movement is one of solidarity. And because of that, I really think that we'll move forward in a positive direction. This is me this summer. I went to Ghana and I went to W.E.B. Du Bois museum where he is laid to rest, and that is his desk in his library. And I was like so happy that day, even though I had malaria. So I just wanted to start out with that and thinking about that word problem throughout, something that we'll do. And one problem is, you could say, and ask yourself if you can actually separate the message from the messenger. Can you yourself separate this message and this song from someone that was deemed a problem, right? With near the end of his life. With this rhetorical artifact, what we're really doing is taking it and the themes and ideas that are looking at a way of life and a way of life here in America for us, as well as the values and practices that uphold a lot of discrimination and racism. And in our case, those practices are based on weight discrimination. So the message of they don't really care about us, and this is learning outcome 1. People that live on the margins of society, we often are seen as invisible. So if you look at the language here, it talks about rights, it talks about being ignored, it talks about having liberty, it talks about being tired of being a victim of shame. We all know too well about fat shame and throwing us in a class with a bad name and not believing this is America. This is our America, as the title of Lisa Ling's podcast. Sometimes we don't realize these systems unless we're faced with them personally. And society ignores the societal neglect and marginalization of the fat other. And our oppression then becomes very normalized, and not only normalized, but it also becomes commodified for health industry profits. But liberation is the end game for feminist scholars and also for critical cultural studies scholars and even theologians. And the reason I add them as scholars is because there's this idea of being a slave to a set of ideas if you think that master is good, right? So they basically look at God as this master that is good, but in the same way, and decide to be a slave to this entity, but in the same way, the entity that we are a slave to is the diet industry and diet culture. The little bit of nuance difference between those two is that you are technically told that you are choosing this choice to be a slave to a god. But is that true? And is that also true in terms of people in diet culture? Typically, they will also say yes. But the problem is that sometimes when our world is so saturated with a certain set of ideas that is then promulgated by media, and those patterns of thoughts and thinking and behavior become an indoctrination of sorts and creates a beauty ideal psychology. And in fact, it's not that therapists don't care about us. That's what I was hoping that people didn't assume when they read the title of the message. It's that the systems of power and domination don't care about any of us. They don't care about the therapists that actually conform to diet culture, and they don't care about us because we're not conforming well enough to diet culture. And why? Because their end game isn't really to help people. Their end game is to really make us continue to feed into that system of power and domination in the form of profits. So just looking, learning outcome 2, if we look at diet culture and its influence, if you look at social learning theory by Albert Bandura, it's been used to understand criminal behavior. And there's a reason, of course, that I use the prison version of this film. And so I'll try to talk about that a little bit as well. So please consider how therapists that are relying on the culture of the diet culture, they're actually informing their practice with something that is abusing their clients. And their frameworks of the diet culture prevails because their beliefs are pretty much left unchecked. And example of diet culture, of course, it refers to a set of societal beliefs, practices, norms that prioritize the ideal thinness, equate it with health and moral virtue, and promote the pursuit of weight loss as a means to achieve the ideal. It incorporates various aspects of our culture, including media, advertising, social interactions, and even healthcare that perpetuates the message that being thin is the only path to happiness, to health, and to success. And this means that unless and until therapists learn to deconstruct and resist these media and other mediated messages that exist in their own lives, in their own consciousness, in their own bias, there's no way that they can help people that look like me. And that's one thing that I want to definitely get across. So for learning outcomes 2 and 3, this is just looking at weight stigma and its consequences. And I think, all week you will be hearing different definitions of weight stigma. And I thought of not even putting in any definitions, but I think it's good because we're getting all of these different definitions from different sources. And I think so I decided to leave it in there. But weight stigma is also known as weight-based discrimination or weight bias. It refers to social prejudice, negative attitudes, stereotypes, and discriminatory behaviors toward individuals or groups based on their body weight or size. It involves the unfair judgment and mistreatment solely because they are perceived as being overweight or obese, often without regard for their individual health, without regard for their abilities, and without regard for their circumstances. And the circumstances here that I'm going to be talking about are mental health. Weight stigma can manifest in a lot of ways, including verbal taunts, teasing, and derogatory comments, as well as more systematic forms of discrimination in areas like employment, healthcare, education, and media representation. It can have serious psychological, emotional, and physical consequences for those who experience it. It leads to decreased self-esteem, depression, anxiety, and even physical health issues. So addressing weight stigma is an important aspect of promoting inclusivity, empathy, and respect for individuals of all body sizes and shapes, as it can contribute to a range of negative outcomes and perpetuate harmful stereotypes and biases. This is a Beauty Redefined curriculum that I started in spring 2022. We use a textbook called More Than a Body. Your body is an instrument, not an ornament. And I call my body image class, I now call it my mother's garden. This was the first set of students that graduated with youth participants that are in the Washington County court system, and they have to do some programming. There was a lack of programming for young ladies, so they reached out to us to help create a girls' circle for young ladies that are at risk for sex work and sex trafficking. And so what we thought of was to create a program that helped them be beyond resilience by really enhancing support in areas such as study skills, doing something that's physically active with their peers, but also mostly talking about self-objectification and ways to combat the media messages that they get every day as a teenager. The summer program went very well. They all swam together, and I just have pretty rave reviews from that. But this semester, we're going to focus on study skills between them and my students. And also a student is working on getting a self-defense portion. So someone would come and teach my class self-defense moves, and then they would go and teach the youth participants. And tomorrow, actually, my next group of students, my new class, is going to get mandated reporter training. So, and the meetings will start in October. So I'm really excited about that. In November, I will be going to accept that award. So hopefully that will give the program the lift it needs to continue to get more funding and to have more people on board to be community partners and partners within the university. So I wanted to put this in the context of weight stigma in America, though we know that this is a global crisis. Basically, this is Farrell's Fat Shame, Stigma and the Fat Body in American Culture. And this text, it has an interesting historical perspective for this particular audience, because you are all therapists, I believe, and in the counseling. Prospective physicians' attitudes toward weight in the 19th and 20th centuries. In this period, physicians were generally more concerned about encouraging patients to eat due to wasting diseases, as they call it, like tuberculosis and malnutrition, which were prevalent health concerns at the time. But physicians also perceived weight gain with aging as natural, and the practice of routine weigh-ins, which is now common in medical context, was not a part of the medical lexicon until much later, well into the 20th century. So this text also explains that as late as 1949, that isn't really that long ago. I know some of you might be really young, but it records from the American Medical Association and indicates that many doctors actually needed to be convinced of the relevance of weighing children. So this historical context illustrates how medical perceptions and practices regarding weight has evolved over time. and it sheds light on the changing attitudes toward weight and health in American culture. So it's important to consider when discussing the development of diet culture and weight-related concerns in our society. I'd like to start off with this. There's a saying that I grew up with: a house divided against itself cannot stand. And I believe that there is a division among people that conform to social pressures of the ideal thin and those that do not, whether or not they are doing it intentionally. And so I'm calling this the diet weight industrialized complex, because it is a huge industry and a profit motivated industry. This one goes toward learning outcome 6. So some therapists actually they conform to those societal ideological positions toward fat people. And in the beginning of Michael Jackson's song, he says skinhead, deadhead. So that's a trigger warning. This trigger warning is on this everywhere. And as he suggests, Bell Hooks does the same thing, and she calls out the exact same system. And she calls the system the white supremacist capitalist patriarchy, or the white imperialist. And so they're doing this thing to the same structure, for the same structure. However, some people feel called out when you do this kind of speech and this type of rhetoric because of the term white or skinhead. While there are white supremacists, we know that, that's just a fact. Basically, people need to realize that there are also Black white supremacists, there are Mexican white supremacists, there are Latina white supremacists, and people from other countries that are white supremacists. Because white supremacy is not a person. It is not an individual person. It is not a skin color for a group of people. It is a set of ideas that we buy into. And these ideas for this conversation are those ideas that promote the notion of this ideal beauty that is a global phenomenon as well. And so while it is necessary to call out those structures, those systems of oppression and domination, we have to understand that they're not intended to call out people, but rather to call out the system in which the social order operates. And artists have been doing this for years. Michael Jackson can be said to be one of the best that has done this. And he's even, of course, if you've heard any of his songs about the planet and how we mistreat our planet, he's done this many times over. And when we deal with one another, when we look at the structure versus the individual, we can be more powerful and have more of an impact when we are dealing with people at an individual level. And I should say that Judith Butler's text, Excitable Speech, she talks about the ways in which, or raises questions about who has the right or the authority to censor speech and silence certain forms of speech. And so it challenges the idea that censorship should always be seen as a threat to freedom of expression. And so that's why I still use the terms, and I just do trigger warnings, but because it highlights the complexities of really balancing freedom and responsibility. And what happens here is when we call out the system, I think what we can do is to start moving toward the individual ways in which we can help one another. And Audre Lorde is another feminist theorist. She says, my silences had not protected me. Your silences will never protect you. But for every real word spoken, for every attempt I have ever made to speak those truths, for which I am still seeking, I had made contact with other women while we examined the words to fit a world in which we all believed, bridging our differences. So here I'd like to just again reiterate how us and them, this sort of us and them mentality, it shouldn't even exist, because the therapists that are in the system that sometimes re-traumatize individuals, they're also victims of a real psychological warfare of the beauty, of the ideal beauty. And so that's what we are what we're looking at and what we are trying to fight today. And so your silence will not protect you. Again, is this text that I want to use in another trigger warning is master's tools. But again, I'm going to bring it back to the context of weight stigma. Policies in your practice, those of you that have practices, can actually help vulnerable people advocate for themselves. Because we often, and I'm including myself in this, we often come from cultures of silence. And so this is where it is learning how to stand alone and unpopular and sometimes reviled, and how to make common cause with those others identified as outside the structures in order to define and seek a world in which we can all flourish. It is learning how to take our differences and make them into strengths. For the master's tools will never dismantle the master's house. And the master's tool for us are the tools of the weight loss and diet industrial complex. It may allow us to temporarily beat him at his own game, but they will never enable us to bring about genuine change. And this fact is only threatening to those women who still define the master's house as their only source of support. And so bringing it down to the eating disordered community, the culture of silence, especially in monetized communities of surrounding mental health, suicide and suicidal ideation, and substance abuse. All of these are cloaked in shame and stigma, which leads to isolation and further rumination and more disordered eating behavior. So silence doesn't cover up anything. I think that's something that we think is happening when we're not talking about certain issues in our communities. It cannot only not protect you if you're silent, but it can kill you. And this is, again, the idea behind mental health, suicidal ideation, and being actively suicidal. Another aspect of this conversation and the master's tools for the weight diet industrialized complex is really our continuing in our community as fat activists to use divisive discourses surrounding terms like fat versus thin, normal versus buff, what the inspiration is, or something like creating different versions of fat, like a small fat, medium fat, super fat. And another one is creating new forms of eating disorders to be recognized in the DSM-5. These are actually the master's tools that are not bringing genuine change. Instead, the question that we have to ask ourselves as a community, and especially therapists like you all and clinicians, how do we take our differences and make them strengths so we can all flourish? How do we do that? That's a question that I'd like you to grapple with, maybe take some notes on, and be able to really think about and ponder. How do we take our differences in the fat community and make them strengths so we can all flourish? And taking it to another level in just the disordered eating community that has people of all sizes. How do we take our differences and make them strengths so we can all flourish? And I know it's a struggle, and I know it's hard, and I'm still there where I would like to see the community more unified. So my silence has not protected me. And I would like to use my experience to help therapists when they encounter someone like me. I've been told time and again that people in the African American community do not often share their experiences the way I share mine. And I've been reluctant to share certain aspects publicly, and I've intended to and edited and, just scrapped things at the very last minute. But here, as I'll start, as a child, my mother, she always called out my fat body. She was a tall, slim restrictor most of her life. So I grew up really entrenched in extremely weight-centric circles. And I've been on a diet literally since I was 12 years old. After, a long history of this, I put myself in therapy, and I was labeled not otherwise specified disordered eating because I did everything in the DSM-5, but I was still fat. And so when the push came to label clients, I was labeled as having problems with restricting. And so I did have the pleasure of speaking with fat African American women and learned that they not only restricted and lived in fat bodies, but they also had a history of family abuse in terms of fat shaming them, partners expecting deviant sexual behavior because they were fat, and living a life of shame and secrecy while outwardly living the stereotypical fat, Black, and happy female stereotype portrayed in media. These women also reported abuse, or one woman in particular reported abuse from and fat shaming in the media, but by therapists and doctors as well. And some just wouldn't get help. They just wouldn't go and speak with anyone. And one in particular did request that I not write in the dissertation her experiences of sexual abuse. And there was another woman who actually was so indoctrinated by the diet culture, weight industrial complex, that she basically objectified herself to such an extent that I didn't include her, because I realized that I was kind of coming up against something more than just media culture, that I was fighting the very self-loathing and self-hatred and internalized fat phobia that I deal with.
Oop, unmute. Dr. Mensah, I just wanted to let you know that it's about 20 to the hour. So about a 10-minute alert to then having 10 minutes for Q&A. And I want to encourage anyone in attendance to start to put your questions in the Q&A box so that we can get going right away once the presentation is wrapped up with answering those. Thanks so much.
Thank you. And so because some of the women sought help from doctors and therapists that identified with diet culture, they basically didn't get any help at all. And so breaking that cycle and that culture of silence is very important. There is, I want to add a little bit of context, and this is learning outcome 4 as well. A little bit of context. In 2015, I was in a very serious car accident, and it led to a concussion that I didn't realize I had. And it really put me in a really foul, disordered eating pattern. And then once one of my therapists basically noticed that there was something very wrong, and set up a team to kind of monitor me, a neurologist, an occupational therapist, a psychiatrist, and her. And basically this team of experts was supposed to help me really get back to work. And I wasn't able to get back to work in a way that was healthy for my situation at the time. I was very sick. I didn't realize how sick I was, but I was. The good thing is that I did have one female therapist and all my therapists were white, by the way. She was a fat therapist. But the other therapist that was in my team to manage me knew as well that I was in a dangerous kind of eating cycle. My goal was to restrict, and they even put me in like an intensive outpatient treatment program. Well, this therapist really actually criminally fat shamed me. And she screamed at me. She told me that I wasn't a victim. She was like, "What are you, 4 years old? Because your 4-year-old tells you to eat lasagna and drink a glass of wine whenever you want." And she said 4 years old because that's how old we think I was when I first dissociated. And when I explained this to my primary psychologist and a good friend of mine, they pointed out that it was fat shaming, and they were shocked and couldn't believe that I continued to go see her. And I do understand why I continued to go and see her. And this is why that re-traumatization happens, because we are raised in an oppressive environment. That is what we understand. And in my mind, I knew that she was right, that I was fat and a lazy and a stupid child. So I needed her to fix me. And so this cycle of re-traumatization that we go to is really interesting, because for me, it wasn't about me being Black. It was, yeah, sure, maybe she felt like she could talk to me in a certain way because I was Black and I could take it or something. But it was all centered around my weight. Being a Black woman just complicated it. Another thing that was going on there was that there was this power difference, that I voluntarily submitted and surrendered to this person in authority because I thought that they cared about me, and I thought that they wanted to help me and that they could help me. And so I don't think people understand the ways in which a relationship with a therapist is. It feels like it can be a grooming process for you to be challenged in those ways. And so you don't even question it. You just question yourself because you know that you are a broken person. And so I had already established a connection with her before this type of behavior started. And in the transformation of silence into language and action, this is another essay that Audre Lorde did in terms of the book, Your Silence Will Not Protect You. And it's a way for me to use these stories to create action and to advocate for people that look like me that will be helped by therapists. And one thing that Marian Anderson said that I do appreciate is that as long as you keep a person down, some part of you has to be down there to hold them down. So it means you cannot soar as you might otherwise. So this therapist, I feel like she wasn't a bad person. I feel like she really believed what she was doing was the right thing and was something that would help me. And unfortunately, that simply just wasn't true. And since we're running out of time here, I will move along. And body liberation or fat liberation is defined as the freedom from social and political systems of oppression that designate certain bodies as more worthy, healthy, and desirable as others. And what we can do to change is to move toward an ethic of love instead of using kind of these hotbed rhetoric and insightful speech, excitable speech, as Judith Butler calls it. This will be learning outcome 8. And Bell Hooks, though, I did want to say that she basically wanted to talk to, people that looked like me to understand oppression so in the end we could love ourselves, because she understood that if we didn't love ourselves, we certainly wouldn't be able to love one another. And so I know there are a lot of white male therapists and white female therapists and Latino therapists and all kinds of therapists that can help African American women. But a part of the ethic of love is for you to understand if you cannot, for you to understand that, you know, when faced with certain types of information, that you do toward a certain type of body. And in that way, just by recognizing and understanding who you are able to advocate in a positive way, and always have in your Rolodex some therapists that would be better suited to help individuals that look like me. Because certainly that's something that we want to do and advocate for, instead of hurting people. A better way, health-centered approaches. Basically, after what happened with that situation, and this person fat shaming me, I ended up going from being, I've always dealt with suicidal ideation, but I went from being that to being actively suicidal for the first time in my adult life. And I don't blame her. I blame the set of circumstances that I was in, and weight stigma and diet culture, because I was very ill. Even my employers knew how ill I was, but I wasn't able to advocate for myself and get the type of services that any human being that was in that situation and had those set of circumstances would need. And so the fact that I had become actively suicidal is really telling of what weight stigma and weight discrimination can do to a person. And so when that happened, and when I realized what was going on with me, I actually reached out to my primary care physician, who answered the phone as soon as I called. And I think that's another important distinction between the women that have been able to help me. She was actually a South Indian woman, and it was because I knew she would answer the phone. I knew that she cared about me, and I knew that she could help. That saved my life, literally, I think. And the first thing she asked me was, what are they giving you? You know, because she knew I was in the accident and they had assembled this team for me. And when I told her, she was pretty upset about the medicine that I was on. And so what I did was probably the wrong thing to do. I just stopped all the medicine cold turkey, and it made me even more sick. And so I was displaced from work because of that situation. And I don't blame myself for that, and I don't blame the work situation, because I think when you work at colleges and you cannot be there for these very serious reasons, there are a lot of systems that are not in place to protect you. And so one thing I did for myself was I started looking for holistic approaches to health. I taught myself how to knit, because my concentration was really bad. It was hard for me to be in a room full of people. It was hard for me to be in a room with 4 people talking. I basically couldn't find anything in I shouldn't have been driving. I had terrible migraines, and I'm really lucky I didn't hurt someone else traveling, because I still had to travel pretty far for work. But knitting helped me actually manage stress. It helped me kind of look at my life and look at myself as kind of this patchwork project that just needed some mending. And so I ended up just really taking the time I needed. And it helped me understand that it was possible that even I did have this victim mindset that she accused me of, and that I was even living in the same system of pretending to be like this fat, black, happy woman that I wasn't, even though I was miserable. And that was a big cause, I think, for my disordered eating. But the thing was that her kind of doing that just triggered me into a very deep depression and this actively suicidal state, because I didn't feel like there was anywhere that I could turn, and I didn't feel like there was anyone that could help me. And the interesting part is that now I am in therapy with a white woman, and she's able to help me. And I also have a spiritual director. Can I have 10 more minutes? Okay.
Absolutely.
Okay. And a spiritual director, and she's also a white woman, and they both absolutely love me and I them. And my therapist, if I called her now, she would answer. I had a nephew that committed suicide. I learned this past week, and I was having a hard time processing. And she answered my messages, and I was able to talk to her. And it's ironic because here I am in Arkansas, and in Arkansas, I'm finding these people that are kind of helping me become a better version of myself without really any psychotropic medications. And also, of course, Sharice Turner is crazy for asking me to speak, because what happened after the accident is I lost a lot of my short-term memory. And so you will see me reading slides, and it's because I just don't have it. I can read it over and over and try to remember it, but it hasn't come back. But my long-term memory has, which is a good thing. And so I am beginning to kind of practice the ethic of love, beginning with myself, and then transferring that out to my students, and then my students going into the community and speaking with young people that also have some body image issues. And so what communication as advocacy, I'm thinking of it in terms of politics, policies, and people. And when you're talking about politics affect policies, and policies affect people. And when you're talking about that, we have to look at things at an individual level. And advocacy and communication are one way that we can really look at and these issues that we have as society, and then bring it down to a grassroots level, like fat activists are doing, in order to help people that are experiencing trauma. I would suggest the governing body of therapists holds individual therapists more accountable by implementing policies that ensure that clients know how to file a complaint. Intake sessions should include information and appropriate steps clients can take. There should be a frank discussion of what that might look like, because of course, if you're in the mental health industry, that might sound like a scary idea. But there could be a way to structure it so that you're safe and the client is safe. There should be a plan in place to revisit and sign a document to agree upon this every 3 months, to track when any disruptions might occur in a therapeutic relationship, so the relationship can be resolved, and it can reduce even the need to file a complaint, which I had no clue how to do, and I was just terrified. And like I said, I couldn't advocate for myself, so someone would have really had to hold my hand in that situation. But it could definitely reduce re-traumatization in people that look like me. So there's a saying, behind every good man is a better woman. In the song, Michael Jackson, he mentioned Roosevelt and he mentioned Martin Luther King Jr. And so I'd like to note that while he mentions them, I understand and see Eleanor Roosevelt as a major force behind him. And she wasn't so invisible, but there are other invisible activists like Bayard Rustin. Bayard Rustin, he was basically the person that taught Martin Luther King Jr. the nonviolent movement. There would not have been a March on Washington without him. However, he's not even cited in the literature as such during that time because he was an openly gay Black man. But he knew that that change basically needed to happen. And also there's someone like Pauli Murray. Pauli Murray was really the mind behind Brown versus the Board of Education, when Thurgood Marshall was the one that, kind of got all the praise for passing that legislation. She was the one that actually wrote it. But because of those times, she couldn't be put up in front of people as an example. So what I think a lot of people don't realize, certainly Michael Jackson was, a part of media culture and he's looking for a certain audience. But I think we don't understand that while people like to use really hyperbolic rhetoric in order to get attention and to sell records or to make money in some way, I think our country, it has a rich history of the ethic of love, because there are a lot of people that don't make the front page because of who they are, because they can't be the center of attention for a lot of different reasons that society has created to keep them oppressed. And so because that ethic of love is really already embedded in our society, I think that we can kind of be those angelic troublemakers like Bayard, Pauli, and Eleanor, and do the same thing for our particular movement. And so I hope this has provided some kind of insights into music and culture, and you can feel free to ask me any questions. I'm sorry for going over. Thank you for listening, and I'll open up the chat myself.
We did have a question that came in that said, it's from Michelle. Thank you, Michelle. Is the curriculum that you created available outside of your organization?
Well, actually, I use the Beauty Redefined curriculum by Drs. Kite and Kite. It's an online curriculum that the young ladies use, and that they use that. But what I'm creating is basically a program that I'm putting together with community partners and with campus partners that are bringing services to those youth. So part of it is, the online part, I would suggest every woman and every girl go to beautyredefined.com, I believe it is, and definitely go through that. But in terms of how I'm doing this, it is absolutely, I call it my mother's garden, because she pretty much inspired it, because she had a very troubled teenage life. And I felt like if she had certain interventions, what I called an intervention of love, her life would have been a lot better. And so would the life of her children have been a lot better. So I'm hoping that, we can inspire these girls to love themselves and love each other, and be better mothers in the future, because the last thing I'd want would be for them to have to be in a facility. And that's the biggest thing that I want to keep them away from.
Yeah. I have a comment more than a question. what really strikes me about your talk, and I remember this from seeing you speak in May, is just this idea of re-traumatization and trust. And I think that's so powerful, and I think that's not something we talk about as much. We talk about trauma, but that ongoing re-traumatization that can happen in healing spaces or spaces that are supposed to be healing, I just find that to be really sobering. So I just want to thank you for speaking so freely about it and sharing your experience, your personal experience, because it's incredibly powerful, and one of the reasons I was excited to see you speak again.
Well, thank you. That the trust piece is huge, because I think I almost really stopped going to therapists at all, because once you kind of make yourself vulnerable, I never ever want to be in that state again. And for that to have happened, it's really, sobering for me to know that I could be pushed to that level. But at the same time, I was angry at myself for a while, but I'm not, because I was really sick. I was really sick. And so I've forgiven myself, because that wasn't my fault. But I see and understand that system of power and domination and how powerful it is. So I'm able to forgive people that play into that system.
Yeah.
Because we don't check ourselves.
Yeah. No, we really don't. And, I think it's important that we learn to check ourselves, but also check each other. Shavis chimed in the comments to say, "We love you, Angela."
I love you more, Shavis.
It's a love fest. I love both of you. Before we wrap up, are there any more questions or comments from attendees? I think we're good. Thank you so much.
Okay, thank
It
you.
was a treat to see you again. And just no question, just a big thank you we have from Anne Claire in the audience. And yeah, just I put my email in the chat. Thanks for the prompt, Clara, Fiona@galenhope.com, in case anyone has issues with continuing education, the CE attendee dashboard. Reach out to me. I can get you in touch with the people who can help you fix that. But it's generally a pretty seamless process. So hopefully everyone will be all right. And thanks again for joining. I hope you've had a chance to attend some of the other talks. We just had a link put in the chat as well about the other sessions, stigmaawarenessweek.org. There's my email address again. And yes, we look forward to seeing everyone at some more of our events this week. Thank you so much for supporting.
Okay, I'll see you soon. Thank you.